Sorry, friends. I did the help grade 4 Varicocele part 1. This is part 2. That was my shameless Stephen Colbert impression, trying to get people to press on YouTube to watch my video. This is my second YouTube posting, and basically was driven out of desperation to find more information on men who have had failed surgery for grade 1, 2, or 3 varicocele. And I was diagnosed with grade 4 varicocele by a resident doctor. And if you've had failed surgery for a varicocele, and it's affecting you physically, and there's a level of disability concerned, I'd like you to email me, and I can email you a study. I'm not a techno wizard, but I've got it on here, and I'll be showing it shortly, and you can see the study, and the print will probably be small, though it might be hard to read, and I can email that to you. Decided to do a little bit of more personal video to kind of attract more attention, and a little bit in more of a personal way. This is actually, the day I post this will be one of the worst days of my life, where I actually show my face and to the world on the web to tell them about my problem. It's basically a problem with the testicle, and if you are queasy about talking about these sorts of things, it's time to go to another video. But if you know people that have a very stiff left hip, it could be the right hip on a right varicocele, and so on. The purpose of this video is to find other men who have had failed surgery for varicocele, because there's lots of studies talking about a good success rate, but 20% of the men who have surgery for painful varicocele, the surgery doesn't work, or the person gets worse. And I'd like to find other men, and what is your progression? How does it affect your life? I've not been able to find a study, so basically get going here. So I looked at the medical library in Winnipeg, and they were not able to find me any studies on the failure group. About 70% of men who are diagnosed with varicocele are diagnosed for infertility problems, and they have surgery, and it works for them, and they're able to have children. So that's great. Surgery also works for 80% of the men who have painful varicocele. These are usually physically active workers, the military, interestingly, and part 1 showed that in the military, stats are reversed. They have 70% of the men come in for pain and physical disability. Getting into my story, in 1995 and 96, I won the Time Exposed Road Racing Series here in Manitoba. Then I broke 4 minutes in the metric mile. I broke 15 minutes in the 5,000 meters, and almost broke 31 minutes, but had an asthma fit in the 10,000 meters. I tried really hard to rehabilitate. I had a pain right here, where in part 1 it talks about the bottleneck of this is where the veins go to, and then they go up through a small tube to the left kidney. But on the right side, usually there's better blood flow, but on this side there's a small tube, and that's why people get left varicoceles. So I had the pain right there, and so I went to Pan Am Sports Medicine, got some advice, did some exercises, stability stuff, lying on your belly, raising your hands behind your head, raising your legs behind your head, or else doing that on your hands and knees. I did core stabilization exercises, eventually did medicine ball, which I thought set me back, and I stopped doing it. Bridging, I did pulling the belly button towards towards the spine. I'm only now being able to do that better when I do it in the water, and so I'm improving a little bit because I do it in the water. Because I'm actually not walking really unless I'm in the water now, and I don't even hardly walk in the water, but I'm trying to be on my feet in the water and be upright. Um, so I did physio, massage, chiropractic, uh, eating more blueberries and rosemary and things like that for varicose veins. Um, no, no improvement. Um, so eventually, I went from running national championships, playing tackle football, things like that, to just playing quarterback and to just playing baseball and slow pitch with the church. Eventually, even that got too hard. In 2001, I was driving a transit bus. Um, and that's when I was running actually during my split shifts on that. Um, but by now I had stopped running and pretty much everything. But now I started to worry about my job because my back would get stiff slowly, very gradually again. Um, oh yeah, I forgot to say with the running, so I did physio, and then I would try running again, and then I had pain here again. I talked to top level coaches and stuff, and then I would do more physio, get more advice. Then I had pain in my right knee. Then I did physio, time off, start again, and then the alternate ankle here, and so gradually, like, it never rehabilitated. So I gradually stopped doing other things, and then started with that back to bus driving. The same thing. So it was. I would first I got cushions, obus form, things like that, and then my doctor took some time off work, and so I had time off, and then it would come back, time off, and then it would come back, time off, and then it would come back. Eventually, in 2006, I was working at a sit-stand workstation, and so I would be sitting, and my legs would be burning, my butt would be burning, everything that was touching the chair. It was not a sciatica pain where it shoots down your leg, or back pain that radiates down your leg. It was what was on the chair that was hurting. And then I would stand, and then my feet would hurt, and the back of my legs would be straining this way or that way, and I would be moving side to side and kind of lifting my legs. And it was the splitting of myself there. That's how I feel about it now. That it was the splitting from reacting to not wanting to irritate what was in between the legs. Um, so eventually I was slowing down for potholes, and that's not a good thing when you're driving transit bus. And so in 2008, I was doing acupuncture and physio. I had a lot of pain on this side when I'm sitting. So the physio saw this seat cushion here, and I got that. Good seat cushion. It's kind of expensive, but it was cut out there and very spongy to keep me off the seat. So that helped, and I tilted the chair back and reclined as much as possible, like I am now. So so I started doing Kegels exercises, and then I felt like I had more problem between my legs. And so, being a hockey guy from Canada here, in Winnipeg, I learned to skate on a pond when I was a kid up north. But so I put on a hockey jock strap, and immediately that felt a little bit better. I felt looser in my left hip, which stiffened up over the years. And 3 days later, I'm in the shower, and I'm like, oh, this is feeling heavier, and I'm thinking between the jockstrap and the heaviness in the shower here, and it's like, oh, this is probably why I was It's probably why I'm having problems in my abdominals holding myself together, because it's like it's feeling like it's pulling me down just after I had put some support on it. It's a reaction. So, so, um, but eventually it was pulling more and more, and I was using one hand for this and one hand to hold it up, one hand for getting a shampoo out, but it was feeling heavier and heavier, and eventually my gut just pulled me down, and my heart rate is like 170. I felt all day like I didn't feel like I had an initial blow, but I felt like in the shower, and then after that, I was like out of breath, like I had got punched in the gut, like when you get hit in the nuts with a hockey puck or the groin, and then that hurts, and then you're winded. I felt like that all day, and then so I went to my doctor, same doctor that had diagnosed me with asthma, um, and the back problems and the hip problems. Um, Sent me to the urologist, and there was a resident doctor there. He diagnosed me with grade 4 varicocele, thus grade 4 varicocele. Um, and I wasn't in the office for 5 minutes. I spent about 3 minutes, uh, and I didn't even tell the story about the shower and the supporter and the Kegels, because he was tired of that. He says, "Okay, just drop your pants. I just want to see it." And then so he's like, cough, and then his resident doctor, and his English wasn't really good. He just signed for surgery, and you need surgery, and I couldn't really talk to him, and so I'm like, yeah, okay, and I signed it. And so I wrote the doctor, and I'm like, well, my heart rate was 38. A few years ago, I was a distance runner. Then I was trying to tell him the history, like I just told you, and um, because of the blood flow and the size of my veins and arteries and the blood volume that I had, and the story here about feeling heavy. And he said it'll only address the heaviness, the dully achy feeling in the scrotum. There was no ultrasound done, and nothing about the veins higher up. And because I had read stuff on the internet about different ways that it could flow. The big word is anastomosis, but I didn't know it back then. Um, so he did the low inguinal surgery, and I think I got everything in there. So I'm going to show that's part of my technological skills here. I'm going to show some illustrations here. Okay, before I do that, actually, what we're talking about kind of is most people know from sex ed in grades 6 or 7 that I got a toilet paper roll here and an expensive grocery bag, and just to illustrate, when it gets warm, muscles relax, and when it gets cool, they contract and pull the testicle up. And what we're talking about here is varicose veins. This would be the cremaster muscle, kind of like a bag, and it's attached to the hip bone. It goes through a tube that's literally attached to the hip bone, and then the veins come up to your kidneys right here. So just illustrating that this is what we're talking about. So the veins get expanded because the valves aren't working in the veins, and so they pool with blood. And these pieces of paper are too big to fit through the tube here, but these veins are also in the tube, but there's like a fatty layer here, and then between the scrotum and the tube, there's like a fatty layer that they're under, and they swish around in here as you're walking. So you can just imagine there's also the effect of, master wants to pull it up, but there are veins in between. There are also veins in here. And there's a bottleneck up here. So this is like water though, and it's like, wow, trying to pull it up. I feel that's a big part of the problem. And in part 1, grade 4 varicocele, help grade 4 varicocele, it talks about this, the backflow, there's other ways that the testicle can drain. But that article is saying you got to cut it up here where the varicose veins end, not down here, because there are varicose veins up here, basically. And that surgeon also, hopefully, he does the surgery up here, and then hopefully these get smaller. But he also lifts the cremaster up a little bit because when he's talking about traction, as I understand it, it's probably because of this. And then the cremaster here is stretched, and so it's probably damaged after the surgery. It's probably too big, so who knows how that affects those nerves. The testicle's probably hanging on the veins or whatever. I don't know about that. I'm just speculating, but I'm not making any magical thinking here. I'm just trying to get a theory. So anyways, that's what we're talking about. So I want to show you some diagrams. And I am not a technical. Sorry about that. But this is the last thing I want to show you. I'm just flipping back to the first thing. I'll go through these fairly quickly here. So we're talking about high ligation. That just means cutting. That's where they cut the vein in the high part above, at the top of the toilet roll, and to treat pain in varicocele. So we're not talking about operations for infertility. We're talking about operations for pain. And this is a PubMed article. It was done in Turkey. And put on the website here by my referring surgeon also uses PubMed. So, but there's limited data about the effectiveness. It's talking about painful varicocele. It's talking about researching guys that had high ligations to determine the effectiveness. So the materials and methods, the patients were all physically active who underwent high inguinal. So here they're recognizing the benefits of doing high inguinal as opposed to low inguinal surgery. And they all had conservative treatment before surgery. That means basically wearing a scrotal support and giving it time. So talks about the age and things like that, but at the top, the pain was dull, and I really like how now they're starting to separate which guys had which symptoms. Pain was dull in 42, throbbing in 25, sharp in 6, a pulling sensation in 14, would be 15, describing it as pulling me down. They had conservative therapy. There were 17 grade 1 varicoceles, 36 grade 34 grade 2. 82% reported complete resolution. Congratulations to those guys. And you other guys who might be watching that had partial response or persistent pain are the guys, you can email me at get your pause finger ready, and I'll show it later, but grade 4 varicocele at outlook.com. That's with a digit 4, grade 4 varicocele at outlook.com. And I'll email you the study, basically asking you questions, some of the things that I went through here. Conclusion is that it's an effective surgery, and it is. But there's questions about the failure and the veins behind where they cut, especially in low inguinal surgery. But researching the guys that had, if you type in high ligation and pain and then PubMed, this is the medical website my doctor showed me. And if you want to find the article, there it is. Here's my email, grade4varicocele at outlook.com. here's a picture from Gray's there. This is the cremaster muscle that hangs down. It drops through the inguinal canal that's attached to the hip bone here. And at the bottom is the external oblique. And there's at the top, it attaches to the rib cage, one side the back, and the other side the abdominals. And so you can move your testicle up and down if you get some practice at it with your cremaster. And then it also can move up and down by flexing your abdominals. So here's my email again. Please email me at that website. I will email you this study if you can't read it here. Not very good camera work probably, but I'm just going to flip through this. Put it on pause if you want to read this now. And here's page 2. These test questions, that's just talking up here. It's talking about it'd be a good idea to find out which veins are not working before you do the surgery and how high up. And then even between the inguinal canal and the kidney there, it'd be good to have that. Imaging or ultrasound is usually done when the patient is in a position like I am right now, reclined. But most of our problems, the guys that fail, just do the research yourself, that we feel better when we're lying down. And then the testicle gets logged as you're standing up. So the test should be as you're standing up. And now here's some test questions. Like I just went through how it affected me, how I slowed down gradually, and I like to know these kinds of things about you. And I have a bunch of questions here. Also your doctor can get a nurse to do that study and maybe publish it. Email me, and hopefully we can find better ways of dealing with it. And so I just wanted to show you that this is again how the cremaster drops through the spermatic cord, and then the cremaster runs through the inguinal canal right here. And this shows how the inguina is attached by fascia to the inner thigh and to your abdominals. But so your weight is obviously on your leg, and the hip bones are like brackets. And if this is pulling down and you've got straining in here, then it's what I'm saying is it's going to be a problem with walking and balance. And then the spermatic cord goes through. There's a fatty layer basically on top of the veins, and so you're rustling those veins when you're walking, and that's a big part of what I think is my problem. And so here's where I wrote my surgeon talking about a 38 morning heart rate. And down here, I was saying, could an efficient cardiovascular system have affected the development and the success of the surgery? So, because I had big veins, and the Part 1 article talked about different ways that the blood flows, and so I feel I should have had high inguinal surgery. Here's a copy of imaging done I had at the Mayo Clinic, which is saying down here that the blood is not definitely flowing in the veins. And this imaging was done when I was relatively in the position I am now. This is a copy of my discogram. All 3 of my lumbar vertebrae were basically perforated. The test failed because they pumped dye in, and then they pumped the air in, and the dye just flew out of the veins, or the discs. So my discs are basically perforated like a bike tube that's got lots of holes in it, and it's pretty much useless to do the test once it's got so many holes. In my bottom vertebrae here, there was no recognizable nucleus left, and I didn't do that very well. That's a note from my doctor talking about how he told me. And here is another one about saying that from part one, I've had few guys respond to me, and I just want to say basically how I've been dealing with it. I've got, I was, I videotaped between my legs in 2012, and I found what looked like scar tissue there. I was not able to really get an honest answer from a urologist of whether or not that was scar tissue, but I did get a doctor from the medical clinic on Broadway, um, and he recommended Gold Bond and gabapentin, so I started taking gabapentin. When I went on gabapentin, I felt like it was working, and I stopped taking the antidepressant and the nabilone, which was really expensive, and I felt like the gabapentin attacks the nerves, so it helps me with the pain between the legs. Um, I've also got steroidal ointment for the anus, and this is calamine lotion with phenol. I was just prescribed that, and that is helping the discomfort in the cracks. Um, but this is grippy, and this can get grippy, um, and affect you when you're walking because of the sliding. But so this is massage oil, and it's kind of embarrassing. But when I videoed, also I saw that my right testicle had moved, the scrotum had moved up and over, and that's probably because the left testicle moved down and into the center, and actually sits in the center. When it's warm and the veins are locked, they just push it down, and so I got this happening, and that actual center line sits about an inch to the right, and then kind of goes down, and it looks like there's scar tissue between the scrotum and the anus there, and that is what is hurting me and bothering me. And then when you walk and stuff, so it is embarrassing. But I used kinesiology tape, and that initially brought within 2 weeks. I went for an exam, and my strength at the physio was 2 out of 5 for squeezing my anus on the Kegels. And after I used kinesiology, I was using athletic tape at the time before I discovered kinesiology tape, which is better. But my strength right away went to 3.5 out of 5, and that was over 2 weeks. So it wasn't because of working out or anything; it was because of the tape. But so that was problematic, and then that's when I was prescribed Gold Bond. But I use a ring around to bring that area, kind of keep the scrotum together between the testicles, and kind of isolate that a little bit. And so I move a little bit better. I feel a little bit better. And I also discovered I put a little thing on there to keep the veins from being rubbed, kind of protect it from my legs, get in between my legs. And I get the testicles kind of protected here. And then I found to try to kind of move the left bag of worms here away from the left leg. So I leave a little space there, and that seems to be working a little bit better. So that's all very embarrassing, but email me if you've had failed surgery, what you're doing and what works for you, and maybe you can help me. Maybe we can kind of get a consensus to get more communication, because each urologist, I think, has well over 90% success rate, and I don't know how many surgeries each doctor does, but there are only a few, and Campbell's urology textbook, first edition, talks about a lot of stigma, just get married, just have more sex, psychological problems with you, and I think people are stigmatized, and because they're not working or having trouble working, then anyway, you can look up the part one, and email me at grade4varicocele@outlook.com. Thanks for watching, and yourself. And I was saying, I was thinking, don't get your balls tied. Okay.